Good afternoon, and thank you so much, Governor, for your leadership and forward thinking at this time of public health crisis. I wanted to say, first of all, that since we have seen an emergence of pockets of local transmission in Georgia, it's absolutely the right decision the governor made for us to be moving forward aggressively with a change in our message that to ensure that particularly those most at risk, those most vulnerable, can be protected. And that is, once again, those older individuals, and older means 60 and over, so that includes many of us in the room, as well as those with chronic health conditions, diabetes, hypertension, kidney disease, immunocompromised individuals, including those on medication, for example, for rheumatoid arthritis, that may make you immunocompromised. And please don't go out if you are ill. I mean, what we have seen cases where individuals known to be ill have gone out into the community and potentially exposed others. So once again, personal responsibility, but also protection of our families is critical at this time of this pandemic. I also wanted to just proactively answer some questions that we are getting, many questions in Georgia Public Health about a number of things. People are asking, what is the capacity now for testing? Our capacity is changed even since I last talked with you. We are going to have 2 additional pieces of equipment to do this testing by Monday. Additional staff are being trained to increase our testing capacity. We currently can do about 50 tests a day. We hope by as early as next week, at the end of next week, we will be able to do up to 100 tests a day. We got additional shipments of materials from the Centers for Disease Control and Prevention to allow us to do this testing. And so we have enough for about 500 patients right now, and will continue to request this from CDC. We could not do our job without CDC's help and support. And so I just want to, again, thank them for the support they've given us and all the other states. It's been a hard challenge for them, and we are lucky to be co-located in this state with such a tremendously supportive partner. We've had many questions from physicians. How can we get our patients tested? And one of the things that I've always emphasized is make sure that individuals who want to be tested don't just go to an emergency room, don't just go to a physician's office, because we don't want anyone with coronavirus or influenza or measles to expose those individuals in the waiting area. Call ahead, make sure that these tests can be done. But CDC is doing everything they can to ensure that we have expanded opportunities for testing. They have actually made the guidelines for the PPE, for the protective equipment for providers taking these tests to be a lot easier. You don't need the special N95 masks to wear a surgical mask, and less protective equipment is required. So this means most doctors' offices can take these tests, which will be as simple to do as taking a flu test or a viral panel. And then these can be sent to LabCorp, which is now functioning, and we're getting many test results from LabCorp tests, which are coming directly to us as well as to the provider, and then our public health laboratory. We please ask the providers who are listening, call ahead, 1-800-PUB-HEALTH, PUBHLTH, which is our emergency contact line, to alert us that these tests are coming in, that we can be on the lookout for them and facilitate, particularly if they're high-risk individuals. I know you have a lot of questions about symptoms. What are the signs of having COVID-19? Perhaps no one has done more to help us in this area is Tom Hanks yesterday, when he tweeted about his COVID-19 infection with his wife, and that their symptoms seemed like the common cold. They had malaise, fatigue. I think they maybe had a runny nose and a cough. These are the same signs you have when you have the flu. These are the same signs you have when you have other viral infections. So it's difficult, particularly for those 80% of cases that are very mild, to distinguish between this and other viral infections. So it's so important to ensure that you, if you have a suspicion, particularly if you've been in contact with someone with COVID-19 or have traveled, that you let the provider know ahead of time and go through those steps to ensure the safety of the other patients and the provider's ability to help you. We also know that 20% of patients have more severe disease, and 5% very, very severe disease requiring hospitalization or assisted breathing. And so for those 20% of patients with more severe disease, we again recognize that those with chronic health conditions, those older individuals, are more at risk for developing those complications. So that's one reason why our guidelines coming out today and will be emphasized and emphasized and emphasized in our communities to ensure everybody gets that message and helps protect their family members and themselves. I'll be available later for questions, but I wanted to proactively address many of the questions we've been getting today at work. Thank you.
Okay, now we'll hear from Atlanta Mayor Keisha Lance Bottoms. Mayor.
Thank you.